Hey guys, Scott here with Servant Shore. Today we are going to go through some patellar tendonitis, knee pain, anything front of the knee. A lot of times you'll see that with runners, overuse, heavy squatting, where that tendon just kind of ends up breaking down. Been seeing a lot of this recently. Had one person that had a lot of knee pain after running the marathon, then half marathon, and then a couple of the other little feeder series that are going on. Lots of knee pain. Stuck with some of these exercises and drills, cleared up within a couple weeks. Being consistent with this is going to be the key. We're going to start off with a couple of mobility drills where we're going to roll out, do a little bit of the voodoo band, and then we're going to go into a couple exercises that are really going to target the quads and try and put a lot of stress and load through that patellar tendon to try and get it to reorganize. We want that tendon to reorganize to the point where when it's pissed off, kind of all jumbled up, fibers are really not oriented very well, so if we can put load through those, the fibers will start to orient so that they can strain and pull a lot better. Okay? That's going to be the goal. So if we can get the quad to loosen up, that will help get some pressure off of the knee passively whenever we're there throughout the day, and then the voodoo band is going to give that a little bit of reinforcement, but we're also going to get a nice flush of the system. We'll do one below, we'll also do one above the knee, and then we'll go into some sets of reps of the exercises. So, starting off, I like a bigger ball to roll out with. It's a little bit easier to get to the quads. You definitely can use a foam roller as well. Personal preference. Lacrosse ball is usually a little bit too small, so if you need a lacrosse ball or get out a lacrosse ball, what you can do is put it up onto a textbook or a plate to give it a little bit more girth to try and get it into the muscle a bit better. So, we're going to go onto the floor. You can start low or you can start high. A lot of that, again, is just kind of personal preference. I'm going to start low, just right by the quad tendon, top of the knee, and then just kind of rolling way down. Really make sure that you're hitting outside and inside of the quads. Quads are 4 muscles, so that you're going to go 2 muscles out here, and then 2 muscles kind of right in the center. One of those center muscles comes up and attaches onto the hip. So you really get all of those muscles all the way up to where we're even nice and high up by the hip. You're trying to get all of those little points. If you find a spot, you can either just kind of sit on it, you can do a little cross friction where you're going side to side, or you can even do a little bit of an active release where you're actively moving the foot up and down to get that to go. From there, we're going to go into voodoo band. We're going to start above the knee. I like going flushing towards the heart. We're going to try and get any of the crap that's stuck in there and push it out. So right above the knee, if you do have some quad tendon pain, you can really crank it down right over that. If not, starting a little bit higher. And then from there, we're going to wrap nice and tight. You're really looking for about 50% overlap, somewhere around 70% stretch. If it's your first time doing it, don't go crazy. It will be uncomfortable. It is a little bit sore, but this is one of my favorite tools that I think everybody should have in their tool bag for fixing themselves. At the end, you're just going to kind of tuck it in. From here, we're going to go through movement. So nice and easy, a couple little squats, nice and straight at the top, up and down. Just to try and get, again, that blood flow, and we're also going to get an active release with that knee movement. You can just bring knee up too if you want. I really do like loading it, getting through a little bit of squats. If you want to do some little mini one-legged squats, you can do that as well. Total on time for this is going to be about a minute, maybe 2 minutes as you get a little bit more comfortable. From there, taking it off nice and quick. Should see some pretty good results. Should feel pretty good while you are there. From here, nice and quick, you can just wrap it up. And then we're going to do one more below the knee where we're actually going to crank and wrap right up over the tendon. This is the one that's going to be a little sore. It's okay that it's a little sore. We are actually trying to go into the tendon. So from here, you're going to start a little bit lower. We're on the calf. And as we go, we're going to work our way up. And then the big key to this one is right over patellar tendon, right where everything's pissed off. We're really going to crank down big pull all the way across the front of the knee. And then tuck it in a little bit. With this, since it's over patellar tendon as well as calf, you can also do a little bit of calf raise and go into a little bit of a calf stretch. But squatting is still going to be the biggest thing. So really trying to work on that patellar tendon and trying to get those fibers to loosen up over patellar tendon. If you want to sit in the bottom, you can kind of work on some of the rotation, trying to get it to move around. I'm going to do a little mini one-legged squats with it as well. You can definitely do that too while the boom band's on. From here, taking it off nice and quick. Get that nice little flush, get that blood rush to the knee. Should feel a little better. Always good to do a little test, retest, whatever that is, whether it's a little one-leg mini squat or squatting all the way down. From there, should feel pretty good. Definitely should feel a little better. It's not going to completely take away any of the pain right in the patellar tendon, but that should help out, especially if it's the first time you're doing it. From there, we're going to go to a couple little exercises. So this one, we are going to go onto a slant board. This is an endo board that I just mocked up into here. So, going, we're just going to do slow little eccentrics down. Once the foot is down, we're going to jump back up. Okay? I don't want up and down. We're not trying to do lowering and the raising phase of the exercise. The goal is get the eccentric. That eccentric lowering is where we're really going to try and reorganize those tendons. So that is the important part of this exercise, is that eccentric lowering. So through here, nice, slow, easy, down. Depending on how far you go up on the slant board, this is going to be harder. Down here is going to be a lot easier. So if you're having a lot of pain and you can only go to there, that's fine. Just remember, hop back up, nice little lower down. Okay? As it gets a little bit easier, you can move your way back up. This should be a little sore. We're trying to load through the tendon. The eventual goal with this is going to be a progressive overload to where we are weighted and we are lowering down. And even if we tried to push concentrically, we wouldn't be able to get that up phase through the exercise. Okay? That's the end goal. Not there yet though, especially if you're starting off. Don't add weight. Focus on that lowering control. Nice and easy back up. From there, we're going to go into a step up. I do like adding a little bit of weight with this even to start with, where we're just trying to go through and loading up that tendon coming up. Everything's slow on the way down. I don't want up and down where we're really pushing off that back calf. I want nice big weight shifts transfer forward, and then on the way down, same thing. If you can, a good way to do it is go flat-footed on the back foot. So if you watch the back foot, I'm not going to push off the toes. I'm going to go straight off the heels, and then coming down, I'm going to go straight to the heel. It's going to be a really good way to make sure that you are loading up quads and build up a little bit of quad strength to try and help support the knee. Those are going to be my favorite exercises to really loosen up patellar tendon, get patellar tendon going. There can be a lot of other movement issues that can affect patellar tendon, specifically a lot of glute weakness. Any sort of side step exercise, RDL, reaches, things like that are going to be a really good add-on. Starting off though, go with these exercises. It will help out